As our loved ones grow older, it's natural to want them to remain healthy and independent for as long as possible. But sometimes there are subtle changes that we might not even notice, or we dismiss them as just part of the aging process. The reality, however, is that the body often sends quiet warnings months, sometimes even a year, before the end of life. It's easy to overlook these signs because they can appear minor at first, but in hindsight, they are often clear indicators of the body's gradual decline. Recognizing these signals early gives us the opportunity to provide better care, create meaningful memories, and ensure our loved ones' final stages are filled with comfort, dignity, and peace. In this video, we're going to discuss 5 key signs that can often appear a year before an elderly person passes away. Some of these signs may be things you've noticed and brushed off, but they can offer valuable insight into what's happening with their health. Stay with us until the end, because understanding these signs can help you prepare emotionally and practically for what's ahead, ensuring you make the most of the time you have with those you love. Number 1. Significant weight loss. One of the earliest and most telling signs that an elderly person may be approaching the final year of their life is unintentional weight loss. At first, it may seem like a minor issue, a belt that suddenly needs tightening, clothes that feel looser, or a decrease in appetite. Many families dismiss this as just part of getting older, but the truth is, losing weight without trying is rarely a good sign. This often indicates that the body is no longer efficiently absorbing nutrients, muscle mass is decreasing, and essential systems are slowing down. Aging naturally leads to some loss of muscle, but when it happens too quickly, it's a sign of deeper issues. The body may struggle to digest food properly, or it may no longer be able to process protein effectively, leading to muscle wasting. This loss of strength doesn't just make movement more difficult, it also weakens the immune system, increases the risk of falls, and makes the person more vulnerable to infections. Weight loss is also a common symptom of chronic diseases such as cancer, heart failure, or kidney disease, all of which can begin progressing long before more obvious symptoms appear. Even conditions like depression or cognitive decline can lead to reduced eating, causing a cycle of poor nutrition and further decline. If you notice significant weight loss in an elderly loved one, especially if they're eating less, feeling weaker, or struggling to stay active, it's time to pay attention. This isn't just about physical appearance, it's about the body sending a message. Understanding this can help you prepare with compassion and make every remaining moment count. Number 2. Extreme fatigue and weakness. Extreme fatigue and weakness are some of the most noticeable changes in the year leading up to the end of life. This isn't just feeling a little tired after a long day, it's a profound exhaustion that doesn't go away with rest. Simple tasks like getting out of bed, walking across the room, or holding a conversation can feel overwhelmingly draining. As organ function begins to slow, the body starts prioritizing essential functions, and energy is directed away from non-vital activities. The heart doesn't pump as efficiently, circulation weakens, and muscles no longer receive the oxygen and nutrients they once did. This is why many elderly individuals in their final months feel weak, unsteady, and unable to sustain the same level of activity they once enjoyed. Another key factor is metabolic slowdown. The body, in its final phase, shifts its energy use from movement to preservation. This means that energy is redirected, leaving the person feeling drained even after a full night's sleep. Emotionally, fatigue can lead to frustration, withdrawal, and even feelings of embarrassment. Many seniors, once proud of their independence, feel upset that they can no longer do what they used to. They may begin withdrawing from conversations, avoiding social interactions, or ceasing hobbies altogether. It's important to remember that this isn't because they don't care. It's because their energy is simply not there anymore. For families, Seeing a loved one go from active and engaged to exhausted and withdrawn can be heartbreaking. The key is to understand their limits, allow them to rest when needed, and provide a calm, loving environment where they can enjoy their remaining days in peace. Number 3. Cognitive confusion or withdrawal. As a person approaches the final stage of life, one of the most striking changes is in their cognitive function. You may notice that someone who was once sharp and engaged starts to forget things more often, struggle to follow conversations, or seem disoriented in familiar places. They might repeat themselves, forget names, or lose track of time, even when they never had memory issues before. These subtle cognitive changes can occur months or even a year before death. This isn't simply forgetfulness, it's the brain struggling to function as it used to. As circulation weakens and oxygen flow to the brain decreases, cognitive abilities begin to decline. People may become confused, have difficulty making decisions, or struggle to recognize familiar faces or places. Additionally, emotional withdrawal can also occur. A person nearing the end of life may lose interest in social interactions, speaking less, or spending long periods in silence. This doesn't mean they don't care, it's just that their brain is no longer processing emotions the same way. For families, this stage can be incredibly difficult. Watching a loved one lose touch with reality or become emotionally distant feels like losing them before they're physically gone. Instead of trying to bring them back into conversations, the best thing you can do is meet them where they are. Speak gently, offer reassurance, and understand that even if they don't always respond, they can still feel your presence. If a loved one becomes more forgetful, confused, or less engaged, don't ignore it. These signs often indicate that the body and mind are preparing for the final transition, and your understanding and patience can make all the difference. Number 4. Frequent infections and slow healing. As the body winds down, one of the most noticeable physical signs is a weakened immune system. You might notice that someone who rarely got sick before now catches every cold or infection that goes around. What used to be minor illnesses now take much longer to recover from, and simple wounds like cuts or bruises heal at a noticeably slower rate. These changes are not random. They are signs that the body is no longer able to defend and repair itself the way it once did. Repeated infections such as pneumonia, urinary tract infections, UTIs, skin infections, and even oral infections become more common as the immune system weakens. Even antibiotics, which once worked quickly, may become less effective, requiring stronger medications or longer recovery periods. Chronic wounds, such as pressure sores, can also become problematic, especially for those who are less mobile, and slow healing can lead to dangerous infections. If you notice that minor wounds aren't healing properly, or if your loved one experiences frequent infections that take longer to clear up, it's important to recognize that the body is showing signs of weakening. In these cases, the focus often shifts from curing the illness to providing comfort. Ensuring hydration, keeping skin clean, and minimizing stress can be more helpful than any additional treatments. Recognizing the signs early can make all the difference in how much comfort and support your loved one receives during their final months. Number 5. Major changes in breathing or circulation. One of the most telling signs that the body is preparing for its final stage is a noticeable change in breathing patterns and circulation. You may notice that your loved one is breathing more slowly or shallowly than before. There might be periods where they pause between breaths, or their breathing becomes irregular, speeding up and slowing down unexpectedly. Some individuals experience a rhythmic breathing pattern called Cheney-Stokes respiration, where breathing alternates between deep, rapid breaths and long pauses. Another sign to look out for is weakened circulation. You may notice that their hands, feet, or even their nose and ears feel cold to the touch. Their skin may appear pale, bluish, or mottled, especially around the fingers and toes. This happens because the body is prioritizing blood flow to vital organs, reducing circulation to the extremities. The heart is no longer pumping as efficiently, and the lungs may also begin to weaken, leading to shortness of breath even with minimal movement. In some cases, fluid buildup in the lungs can make breathing more difficult, causing a persistent cough, gurgling sounds, or a feeling of tightness in the chest. These changes are often misunderstood as congestion from a cold, but for elderly individuals nearing the end of life, they can signal a decline in lung function. Creating a peaceful environment, using a humidifier, and offering small sips of water can help ease their discomfort. In some cases, medications or oxygen therapy may provide relief, but the focus should be on comfort rather than trying to reverse the inevitable. As we come to the end of this video, let's reflect on the 5 key signs we've discussed: significant weight loss, extreme fatigue, cognitive confusion or withdrawal, frequent infections, and major changes in breathing and circulation. These signs often appear months or even a year before an elderly person's passing. They may not all occur at once, and they may not always be obvious at first. But when you start noticing them, it's a sign that the body is preparing for its final transition. For many families, accepting these changes can be incredibly difficult. It's natural to want to fight against them, to encourage a loved one to eat more, move more, or push through exhaustion. But sometimes the best thing we can do is listen to what their body is telling us. Instead of focusing on trying to reverse the inevitable, we can focus on making their remaining time as peaceful, comfortable, and meaningful as possible. Understanding these signs isn't about fearing death, it's about being prepared for it. When you recognize these changes early, you can offer better care, make important decisions ahead of time, and ensure your loved one's final months are filled with love and dignity. Cherish the moments you have left, share stories, and let them know they are valued and not alone. Thank you for joining me today. I'd love to hear from you. Leave a comment below and share one thing you learned today and how you plan to use it in your life. Your thoughts are important to me, so don't hesitate to share them. Reading your comments gives me great motivation and encouragement. If you found this video helpful, please like, subscribe, and share. Your support helps me continue creating good content to inform and inspire you. Thanks for watching, and I look forward to seeing you in the next video.